the question for all of you, but maybe we'll start with Usha, is I'd like to kind of get an understanding for how all of your jobs have changed since the COVID-19 pandemic started. You know, what's changed about the way you provide care to your patients, the way you interact with physicians, and other aspects of your job.
So as far as the quality of care is concerned, that's not compromised at all. For the past 9 weeks, I've been working from home, conducting virtual visits through telephone visits as well as e-visit through Ontario Telemedicine Network. I know a few weeks ago we did have a session on e-visits. So I'm part of the OTN network, and I can do sort of video type visits as well. And in addition, IBD nurses have been providing telemedicine support for a long time. That's part of their role. Patients will call you in between physician visits. They would ask you questions about medications. They will ask you questions about the disease, any side effects they're having, nurses play a key role in providing that telephone service. I have a dedicated email address for the patients that the patients will email me at. I've had that since our IBD clinic started about 10 years ago. And I find that patients are very reasonable. They'll only call you when there is a need and will not call you if they don't need you. Having that email, I find very helpful because they list all of the questions, concerns, then you can call them back and talk to them. In addition, I'm also providing the collaborative care model of care, which means that the GIs would be consulted when I have to talk to the patients. I also get assigned patients in their clinic that they want me to call. So I will call the patients. Patients are very receptive of me calling them, talking to them, and also, providing some recommendations. And being a nurse, you develop a trusting relationship with your patient. Having that trusting relationship, the patient will be happy that you've provided that care when they need it, and also trusting of what recommendation you are making as a healthcare provider.
Great, thank you. Anybody else want to chime in on what might be different?
Yeah, so I can jump in a little on sort of experience from the pediatric side. I know since the pandemic has started, we had quickly ramped up to virtual care pretty much in about 2 weeks or so. We were seeing patients virtually up to about 75%. And so the joke that's running all the time is that if we were to sort of implement this universally, it would probably take 2 years. So I think with the pandemic, it gave us a little push. So ours is 2-tier. For the ambulatory setting, about 75% are now virtual care. But I also have to mention the side where inpatients do come in, for example, in the short stay unit, where we were asked to move patients out to the community for their injection or their infusion. So that was a bit more gradual, but I like to reiterate the fact, and I know we had the infusion center panels a few weeks ago, that really with their help, we were able to move out these patients quite quickly. So for the first 2 weeks or so, we were able to move about 50% of patients out, and about a month later, it was about 90%. The one thing I do want to acknowledge as well are patients and families, because they truly have been amazing partners for us. Where we do assessments, palpating an abdomen or doing any kind of exam is now a bit challenging, as you can imagine, with virtual care. Caregivers and families have really stepped up. They were so quick to accommodate a request for weight, for example. In pediatrics, we do ask for height, even if it's a guesstimate height, if they have Crohn's disease. And they're also so quick to respond to requests for photo images so that we can assess them. So they really have been our eyes and hands since the pandemic.
Yeah, it's certainly changed a lot of the ways we've provided care we would never have dreamed of 2 months ago. Anybody else different?
The only thing, if it's okay, I'd like to just add into that. I also have been working in the acute care setting throughout the pandemic. And in fact, probably for the first month, really focused my care into supporting the acute care admissions. And our acute care inpatient service has continued on with very similar to numbers to what we saw in advance of the pandemic, in the fact that when patients have flared, we facilitated admissions through the clinic directly into the hospital. So we're trying to keep patients, when at least the clinical areas where in advance, we're keeping them out of the emergency department. Probably the biggest difference that I'm seeing in that is, one, comforting patients that if you're acutely unwell and you have symptoms of a significant exacerbation, it's important that you seek out care, that you communicate that you're having troubles. The hospitals are safe. We all wear masks. The patients wear masks, especially if they're outside their rooms and we're mobilizing them between different units or for procedures. Patients with COVID are isolated. They're usually isolated. I know for our facility, they're all in one wing of the hospital. They are on one specific unit, with the exception of patients in ICU. So the hospitals are not a high risk area to enter into if you need care and you should be coming. Currently, there's no visitors allowed into the acute care facilities. And because of that, the acute care team has really taken on a role around social support. We're trying to spend more time with patients. We're doing Zoom at the bedside. We're doing teleconferences at the bedside to communicate with families. But we're also really taking on a role of trying to provide emotional and social support for people who are isolated in hospital in the absence of their normal support structures.
That's great. And I think that's an important message that you just sent, is that I'm certainly hearing from my patients, and I'm sure you all are as well, that they're worried about coming into the hospital to get blood work done or to pick up a stool sample kit or drop off stool samples. I think, Joan, what you're basically saying is that it's pretty well there's no safer time to be in a hospital, because people are being screened at the door, everybody's getting a mask, visitors are not allowed, and the COVID patients are in a special isolated ward if that hospital has any COVID patients. I know mine does not, but so, I think the message there is, don't be scared to come and see us. If we're telling you you need to be seen, or we're telling you need to have blood work, please come.
Absolutely.
Kelly, I think you wanted to say something earlier.
Well, the only thing that's striking from a perspective when I listen to all these nurses from across the country is how amazingly well it's all working, and how we've pulled it together so quickly, and we're providing care, really, really efficiently and with good outcomes. So I think as nurses and as CanIBD, we should be proud of what our nurses are doing and what they're doing together.
Oh, that's great.